Hello, my name is Dr. Chris Coker, and this is ChristianWebMD. The topic at hand is headaches, and specifically the evaluation of headaches. You see, all the time in my practice, I get the following, basically. Doctor, I have a headache, and I've had it for some time. I think I need an MRI. The answer to that is that you could be right, but not every time. See, an MRI is an expensive test. And more importantly, the MRI most of the time doesn't help me find anything that has to do with a headache. There are some exceptions to that rule that we'll go over in just a minute. Most headaches end up being stress or tension headaches, and obviously an MRI will not be able to find anything associated with that. We look for what we call red flags. If someone has red flags that would indicate that there's a mass in the brain or bleeding, we might do some kind of imaging study, whether it's a CAT scan or an MRI. That would have to be things like intractable nausea, vomiting, loss of use of one or more limbs, vision changes that are persistent and consistent, growing headaches. Those are things that I think of when I see that someone may have, for instance, a brain tumor or some other kind of growth. Most people don't have that. It should also be known that blood work has very little role to play in most people's headaches. There is a rare disease called temporal arteritis where a blood test can be very helpful. But that's the exception. With migraine headaches, for instance, blood work doesn't help, nor does imaging studies. If you think you have headaches, you probably should see your physician, especially if they're consistent. But keep in mind that imaging studies, blood work, etc., have very little role to play. Instead, we focus on trying to get a proper diagnosis through the history and physical, and then proceeding on with treatment. Also keep in mind that this video is for educational use only. It should not be used to diagnose or treat any disease. If you have problems with headaches, please see your doctor. Thank you for watching Christian WebMD.